Hello, everyone. Welcome to another day with your fertility specialist. I hope you're all having a very nice day. Please, as we're starting today's session is going to be very impactful. I'm very sure we all have, sisters, we have mothers, we have women around us, and this topic applies to them. So please, let's do well to call them up. If you need to send them data, please do send them data. Send them money to buy the data. Send them the link too so that they can also partake from our today's live session. So today we're going to be talking about preparing for motherhood. We know that is a journey that never ends, and it's a very interesting topic. And to take us through this topic today, we have our very own Dr. Jane, who is a consultant gynecologist, and she's going to take us through today's session. Dr. Jane, it's very nice to have you here with us.
Thank you very much, Simi. It's great to be here again.
Welcome.
Thank you.
All right. So there's this trend that was happening on TikTok. I don't know if you saw it. Maybe you didn't see it. People were saying me before pregnancy versus me after pregnancy, and some of the befores and the afters, they were wonderful. So when you hear the word motherhood, what comes to your mind? What exactly comes to your mind?
Wow. Interestingly, motherhood encompasses a whole lot. Well, it's a very broad area. So, motherhood has to do, you can talk about biological motherhood, where it has to do with pregnancy, childbirth, talk about nurturing, talk about even the psychological aspect of just caring for whoever you see around. So, motherhood is a whole lot to discuss. So, it doesn't just stop at caring for most importantly pregnancy and childbirth is what most people see as motherhood, but it encompasses a whole lot. But for our discussion today, we generally provide focus more on motherhood, childbirth, before childbirth, in pregnancy, and after childbirth.
Okay, so now talking about before pregnancy, people get married and then your family they're asking you, when is our baby coming? When is our baby coming? 1 month into the marriage, 2 months, when is the baby coming? So, for people trying to, conceive, after getting married, or maybe even single moms that just, want to have their kids. So what are some things you think they should do? What are some things they can do to prepare themselves for motherhood before conception?
Wow, interesting question. Thank you for that one. I would say before conception, there's a whole lot to be done. We would I think this the purpose of this discourse, we don't just want to see women in pregnancy,
Yeah.
because there are a whole lot of things that you can do to improve your chances of getting pregnant and even maintain a healthy pregnancy. And that is the concept of preconception care. Preconception care is just a specialized form of care that's offered to women who intend to get pregnant, to help them and to stay healthy in pregnancy, and also help them have healthy babies and they're healthy at the end of pregnancy. What can these women do? Yes, we have the trying to conceive women. Yes, before you get pregnant, there are a whole lot. You need to ask or seek care or ask for counsel or guidance or what you can do to help you conceive. So there's a whole lot that can make you not conceive. And unless you see your specialist, your gynecologist, you might not really know. And those are very important things we need to do. You don't just sit and assume because your elder sister got pregnant 1 month after her wedding,
You too, you'll
yours
get
you should be
pregnant.
2 weeks after. No, you have to. Sometimes when it delays, you want to find out what the problems are. They could just be very tiny things that once you are guided properly, you can sort out those. What about other women? In preconception care, there are little things as lifestyle, weight loss can help improve your ovulation rate or fertility rate. That has been noted significantly. We
Wow.
also want to talk about your lifestyle, such as alcohol, cigarette smoking. People are into all of those, take some of those drugs.
Social lives.
Sometimes you want to reduce significantly or entirely stop because they have a way of affecting your baby, especially in the earliest form of pregnancy where the organs are formed. You also want to encourage women to start what we call prenatal vitamins like folic acid to prevent them from having babies with abnormalities. And all this should be done like 3 months to pregnancy. And that is why we want to advocate for the concept of preconception care to help motherhood. Then we also have women who have medical conditions such as hypertension, diabetes, a whole lot. Even people that have epilepsy or seizure disorders, as we say, sometimes you want them to come because you want to control the condition. There are some drugs they might be taking that might be harmful to their babies. You either reduce the dose or or
Or
change the
change the
drug
medication.
entirely. So you don't want to continue your pregnancy journey with a harmful drug for your baby, and all those things can lead to deformities or congenital problems, like what we call congenital abnormalities in your baby. So there's a whole lot we need to do. There are so a lot of medical conditions that you need to see your doctor for. You don't just sit, get pregnant, and come. Sometimes all those things need to be controlled to improve pregnancy outcomes.
Speaking of delays, you mentioned the delay. How long should a person wait if you are, trying to conceive? How long do you think a person should wait before seeing, a specialist concerning their delayed conception?
Okay, so for women, yes, standard things we say for women less than 35,
Hmm.
we expect you once you don't conceive, you are sure you have been living with your partner or your husband for a period of 1 year, you have regular sexual intercourse, and you are not able to conceive within 1 year, then we advise that because a lot of women would have conceived within about 90% would have conceived by then. You're advised to see a specialist. For women over 35, we don't want to keep longer. Remember, as you age,
Your
your
eggs
ovaries, your
reduce.
ovarian functions significantly drops. So 6 months, we encourage you to seek medical help. But again, this is a thing of a mindset. So someone you don't have to wait if you feel strongly that after 8 months, 9 months, I want to see a medical professional. Nothing stops you from being evaluated earlier. But sometimes if you must wait, then don't wait beyond those times because those are the maximum stipulated times to seek care when you are failing to conceive.
Okay. So please, I do hope we're actually learning. It's not too late. We're just getting started. Please still do well to share this link. Do well to call up your friends. Do well to, show love to someone by actually engaging them in this particular discussion today. So now let's get into pregnancy. That's now we're pregnant, we're happy, we're waiting for our baby to come. So what are some of the things, these women need to do to prepare themselves for the arrival of the baby and to ensure that this baby doesn't just arrive but arrives in good health, because it's not about having babies, it's about also having healthy babies.
Okay, thank you. So, well, when I talked about preconception care, I forgot to mention the emotional aspects, right? You need to prepare psychologically because a healthy mind is the beginning of a healthy pregnancy and a healthy woman. So, we need to start from that point. Then, when the woman gets pregnant, there are a whole lot. You need to see your doctor frequently, what we call antenatal care,
Okay.
because that care is a special care offered to pregnant women to help them maintain healthy pregnancy through the 9 months of pregnancy. And for every antenatal visit, there are a whole lot of things that you would benefit from. There are different checks at different times. Sometimes you are counseled, you are advised on good social lifestyle, your habits to improve your outcome, how to prepare, when to seek medical care, what are alarm symptoms that you should be prepared for, so that you don't just come in pregnancy. There's a concept called birth preparedness and complication readiness. Yes, it's a big word, but what it just means is that the woman should be prepared for her birth. So that's why a lot of times tell the woman, okay, get your things ready. Who is bringing you to the hospital, even if you're not mobile? Who is going to care for your children in your absence? Because sometimes these things a lot they affect the psychology of the women when they are alone in the hospital.
Yeah.
What happens if there's a need for a surgery? Who gives consent? Do we have money stored up somewhere for some of these procedures? So you prepare the women. We don't just tell them, don't just come to antenatal, and that is why it's a journey. with the clients as they come for the antenatal care. For every visit, there are things you check. We do some blood tests, we do some urine tests, and for those that need specialized tests due to one medical condition or the other, we are we do all of those. Then there are some that you might need to co-manage them with specialists. So you don't just sit at home. Probably you have a medical condition and you just sit and wait. Okay, my doctor said this. No, we co-manage you with experts in those fields. That is what we your medical conditions to improve outcomes and ensure that at the end of the pregnancy we have a healthy mother and a healthy baby at the end.
So now let's talk about habits. Habits during pregnancy. What are some habits that you think women should drop and habits women should pick up? Because during pregnancy they say, this one works for me, or this one, take this one. There are a lot of things that they tell you to take and things they tell you not to do. Some of which are not correct. So, from a doctor, what are some habits you think that people should adopt during pregnancy?
Well, generally, we encourage people to pick up healthy habits. Like this, I mean your diets, exercise, um, regular follow up, get as much rest as you can, and also well, if you have issues or psychological problems, you could see your doctor. You can also consult a psychologist if those
Yeah.
services are available. All those will help you improve your outcomes. Those habits that will encourage women to stop, that basically habits that will be harmful to the baby and also put the woman in harm's way. For instance, a pregnant woman indulging in alcohol, the alcohol can affect the baby and also even the mother. By the time she gets drunk to a point that she has to fall there and here and there, can have trauma. She can start to bleed, placenta can separate, and before we know it, we are already having an emergency on our hands that is preventable. How about women that smoke cigarettes? All those things have harmful chemicals that can harm the baby. Yes, some people will say, drink this herb, drink this water, drink this. We used it in our time and it was
And it
fine. But
worked.
the truth is, for every time you speak with your obstetrician or your doctor, they are able to tell you on the right things, recommended things that will help improve your pregnancy journey or the outcomes of your pregnancy. So we don't encourage people to take things, considering that these things don't have standard dosages, they don't have standard quantity that you want to talk about. So you just have things in a bottle, in a
Just
nylon.
put
So
back of
we don't
tree,
know how much, yes, back of tree,
the
brown
leaves and all
leaves,
of
and
that.
all of that. So we discourage a lot of all those habits, but we encourage healthy habits, fruits and veggies, good eating habits, exercise, and frequent follow up with your doctors.
Speaking of follow-ups, how do you advise men to come for these follow-ups?
Oh,
Because a lot of women, they go through this journey alone. Their husband is like, okay, today is your visit. Okay, enjoy, or go and come back. You tell me what happened. So how important are these support systems, either in the form of a father, of a husband, or a mother, a friend, during the course of motherhood journey?
well, to be honest with you, we are super excited when we see the men in the antenatal clinic with their wives. Yes, you need all the support you can get in pregnancy. A man walks in with his wife, they are able to take the information. So the part that you even explain the woman doesn't get properly, the husband is there to know the doctor. So they help themselves in a way that the doctor says, take this drug this way. Even if she doesn't want to take it, he said, no, I was there.
When the
So you
doctor
don't have
said,
mix of information, and the support alone, it improves the woman's psychology, her mental health through the course of pregnancy, and outcome is a lot better when we have. So we are excited to see the men. Yes, other members of the family can support. We have your siblings, your moms, your sister, whoever is around. Any form of support, as much support any woman can get in pregnancy, she should get all of that because pregnancy is a journey, not just, and you need people to walk this journey with you to make it a lot better and easier.
so women that don't have support systems, do they usually have, let's say, worse outcomes during
Yes.
pregnancy?
Yes. Well, the support system a woman gets can tell you how much the success rate of her pregnancy outcomes you expect in the course of the pregnancy and what you should look out for. While a woman without support system, there are a whole lot from mental health issues like um you have them during the course of pregnancy. They have what we call psychosis. Psychosis is, well, they have some psychological problems. They
Mm.
can even be depressed. A lot of medical conditions because of lack of support. A lot of people are anxious, they are scared. But when you have someone always around giving you a pat on the back, this will be okay, this is fine, no problem. Let's see the doctor, let's find out what the problem is. It's almost like a voice supporting you through this journey compared to a woman who is sitting alone. And that is why when you have sometimes when you have single mothers
Mm.
and those that have support or people that are not alone, people that carry pregnancy through a journey, most times statistics have shown that those that have the support or have someone beside them all the time tend to do a lot better than one the other person. Even post pregnancy, the problems following delivery, those without support
Depression and all
tend
of
to have a lot
that.
of depression, a lot of anxiety, a lot of problems. Even the babies born have their own problems, breastfeeding issues. So it's a whole lot without support. So this journey is not a one man journey, it's a journey of a whole community, a whole town. Whoever is willing to
The
help,
entire
please come and
family.
help me. Yes.
Okay. So, we know pregnancy can be very, it can be a roller coaster, from the changes in hormones, emotional shifts, mood swings here and there. So, how do you encourage people, how do you advise people to manage all of these changes that occur during pregnancy, both, emotional, physical, mental? How do you encourage people to, manage it?
Well, um, the emotional part of pregnancy is something that we just discussed that when you have support system, a very good support system, you tend to run through the journey almost like a walk in the park. For instance, a pregnant woman always showing up very early in pregnancy, and she might not, by the time you are able to request, oh, my sister, my brother, or my friend, can you make this for me, this is what I want to eat, because she might not even have the strength and she has someone that is bringing it. You see, they said if this the emotion, your outcomes or the way the person turns out to be after the whole pregnancy is a lot better. You have someone to support you, so your support system has a huge role to play in the course of pregnancy journey and how it affects your emotions, your stability, outcomes of your baby, and also outcome of the mother, and how she picks up the necessary mother crafts that will be taught along the line of pregnancy.
So, my friends, I mean, my viewers, I hope you all are learning something. For those that have wives that are expecting, or, sisters, cousins, women that are expecting, now you can see the importance of them having you as their support system. You don't have to be the husband to be there for them. You don't have to be you don't have to be their blood to be there for them. Even as a friend, just check on them, check on your friends that are, going through this process of motherhood as we know it. So, Dr. Jane, let's talk a bit about, when it comes for antenatal, they do a lot of tests. What are some of the importance of this test? Because a lot of people, they're like, I know this one. Is it necessary to do this one? Is it necessary to do this? My mother did not do this. So, how important is it for these people to actually, do some of these prenatal testings and all of that?
Well, all this, the whole test, as they are requested, they are very important for one condition or the other, and those things improve outcome. So, if I tell you to check your blood level, I want to know what your blood level is, because if your blood level is very low, you likely have a small baby and a lot of other problems that can come with small baby. What about checking your genotype? If you are AS and your spouse is AS, we anticipate the chances of you
A
having a
sickler.
sickle cell anemic baby or a normal baby, whichever happens, something to prepare the mind for. What about the blood group? What about checking for other infective conditions and all of that? So, for any condition we test, it's important because for every result we interpret it based on the clients and how we can help surmount the problems that could come with those the results positive or negative, and will guide you through the process and even prevent, for those that can be transmitted to the child, will guide you through the process on how to prevent mother to child transmission of some of these viruses or bacterial infections.
So please, it's very important when they say do HIV test. Please know that it's not for it's for you too, but it's also for the health of your baby to be sure that you're not transferring anything to your baby because it's not just about having babies. We want your baby too to be healthy. That is the end goal for to have a healthy mother and a healthy baby at the end of the day. So I think we should be rounding up. So, Dr. Jane, as we, round up, do you have anything to say to our viewers? You know,
Well, I would like to say that motherhood isn't a destination, it's a journey of love, learning, and becoming. You are more ready than you think. So I advise you to stay positive and your outcomes, healthy mindset, and your outcomes will be superb. Thank you.
okay, so want to thank all our viewers. Thank you all for tuning in. Thank you all for, taking our time to actually participate, to actually engage into this show. We appreciate you for our constant our posts, who clicks on our videos, who shares our videos. We appreciate you all. We see you all here at House Hospitals, and we are really grateful to all of you. As we close with today's show, I wish you all a great day. Have a nice day.
Thank you.